Of that package, because I want to give you the latest with regards to the situation in Gauteng with regards to COVID-19. As you can see, the Premier, David Makhura, there will be giving us an update, and the presentation will cover a comprehensive health response as well as education and schools reopening. Let's listen in.
The results of the team that he works with are out. So today, myself and the MEC for Health are doing the briefing. We will also cover the issues related to education. As we always do, those are the 6 pillars of our COVID response. We don't always have all the time to cover all of them, but we will do those that are important for members of the public to know, especially our health response, our food security and social relief response, as well as social mobilization against COVID-19. So where are we? This is what was announced by the Minister of Health yesterday as a country. We are at 58,568 confirmed cases. This is cumulative since patient zero. We have 33,252 recoveries. The number of deaths, those who have succumbed to COVID-19 in our country as a whole, is 1,284, and the test conducted, it's over 1 million. You would, in there, where is Gauteng? Gauteng is at 7,953 confirmed cases. We also give you a breakdown, as we do every week, just to look at this in perspective. How many confirmed cases nationwide? What is Gauteng's contribution to those confirmed cases as of cumulative confirmed cases? We're at 14% now, and it is clear we will be explaining to you the number of confirmed cases have increased in Gauteng, so our contribution to the national confirmed cases is more than where it was last week. The number of active cases, consequently, is also more. We're going to be sharing with you where these new cases are coming from and what we are doing to combat the spread of COVID-19. Recoveries and death, again, the national picture. This is just what we do. Every week we share with you, taking those numbers, break them down to indicate how many recoveries, what our contribution to recoveries are as a province, 9%, what our contribution to the number of total death across the country is 5%. And where are other provinces in this regard? We always share with you this graph that shows you what's happening. You can see that Gauteng's confirmed cases, especially with regard to the active cases, the new cases, there's a spike. For a long time, we had a graph that was doing what we like, that's flattening for a long time. Over the past 2 weeks in particular, there's a spike. So you will see that our graph is inclining. The number of recoveries, as you would see, that is the graph that's now flattening. We always want more recoveries. But if you have more active cases, more new cases, what that does, obviously, is that it undoes how many recoveries. It takes up to 14 days for people to recover. But if within 14 days we have had as many new cases as we're going to show you, that dampens the recovery, because these new cases, in a week or two from now, these new cases would be contributing. A lot of them, more than 80% of them, would be they're just mild. Some, in fact, are just asymptomatic, but people have tested positive. So we have an increase in the number of active cases. So if you just go further to look at the breakdown of the number of cases, those 7,953 cumulative cases since patient zero, that's where we are now. If you take that and then you say how many recoveries we would have, it's 47% recoveries and 52% active cases. That was last last week. As of the 4th, this week you would see that we have a significant increase in the number of active cases. We now have 62% active cases. The difference in terms of death between last week and this week, we have 20 more people who have succumbed to COVID-19. And I would like to take this opportunity to convey our condolences to the families of the bereaved. And we hope that their families will find comfort as they bid farewell to them under very, very difficult conditions of COVID-19. These are our fellow residents and our fellow South Africans who have succumbed to COVID-19. What does this mean going forward? If we just look at what has been happening since the lockdown, new positive cases per day. Today we are sharing with you the full journey from patient zero in Gauteng. You'd see when we were under full level 5 lockdown, the number of cases were persistently and continuously low. From March, they were except one time only, they were over 100, 124, but from March right up to May, mid-May, our number of cases were below 100. You would see that from towards the end of May, a number of cases started to hit above 100, and that's when we were basically still in level 4, and the number of cases started to go way above 100, even to 200. The latest trend over 2 days this week, we have clocked the number of cases that are above 500. That was 649 and 758 cases over 2 consecutive days this week. So this is where we are. As of this briefing, we have reported the highest number of daily increases in COVID cases in our province ever since patient zero. And this has far-reaching implications for everything that we are doing and we are going to be doing from now onwards. Again, here we break down this in terms of in 34 days. The first 34 days of the lockdown, you would see what in that whole 34 days, how many cases we would have had during level 5. And then you see in level 4, in 31 days, how many cases, the total number of cases we would have had in 34 days during level 5 would have been equal to the number of cases we would have had in 31 days during level 4. But now, just in 11 days during level 3, we have the same number of cases we would have had in 34 days in level 5 and in 31 days in level 4. So you can see that essentially I'll come back to the conclusion. The pandemic is gaining momentum in Gauteng province. And that's the critical message I would like to send on behalf of the Gauteng provincial government, that the pandemic is gaining momentum in Gauteng province. And we've got to face this reality head on. And where there's no compliance, we would like to send a very strong message out there to our communities, to workplaces, that this completely will undo any gains we had made during the lockdown, especially during the full lockdown, those 34 days where we made significant gains, and the additional 31 days where we also were able to slow down the pandemic. So we are at 7,953 cases confirmed positive cases. Cumulatively, we are at 2,948 with regard to recoveries. So you'll see that we have got about 5,000 active cases, basically. So the critical question, of course, is where are these cases coming from? We start to give you the regional breakdown as we do. So this was last week. Last week when we did the last briefing here on Friday the 5th, we were at 4,839 confirmed cases cumulatively. As we say now, we have 3,100 more cases over this period. We do a breakdown. How many of these cases are in Johannesburg? 2,399 Johannesburg. 989 are in Ekurhuleni. 614 are in Tshwane. 112 are in Sidibeng. 436 are in the West Rand. And the others have not been allocated over the last 24 hours. They will be allocated to the relevant regions in the next day or so, so that we do not have what is unallocated. This is always a function of the last data received from the NICD. So we give you a breakdown there of how many active cases versus recoveries are in each of those regions. You would see there are more recoveries in Johannesburg, but also more active cases there in Johannesburg. And then followed by the number of recoveries we have in Ekurhuleni, and then the number of recoveries we have in Tshwane. But you would see that in the West Rand, we have more active cases. It's still a function of what has come out of the mines in the last 2 weeks, in the last 2 weeks. But there's also a slide we will show you that shows how many recoveries are we also getting from the West Rand. 2 weeks can be enough to look at those who would have tested positive 2 weeks ago. There's quite a substantial number who have recovered. We're going to be sharing this with you. You would see that in Johannesburg we would have, again, this is as of this week to look at, and I want to draw your attention to the difference between last week. This is last week. Look at the West Rand had more active cases last week. Look at what has happened to those active. It had 372 cases and fewer recoveries. Because this is an important explanation of what's happening to the areas that we call hotspots. So if you look at where the West Rand last week had a lot of active cases, 372 out of 436 cases. And last week the West Rand had much fewer recoveries. Where are they this week? They now have 200 240 recoveries, and this is substantial. Compared to the 40 recoveries last week, 240 recoveries. Although the number of active cases in the West Rand is still high, and we know exactly where this is coming from, I'm going to share with you that data. It's not just in Mirafong now, there's also an area in Mukhali City that shares some mining activity. But you would also see that the number of active cases in Johannesburg has increased. The number of active cases in Ekurhuleni has increased. The number of active cases in Tshwane has increased. So essentially, significant gain is being made in the West Rand with regard to recovery. But in other areas of our province, you would see that there's additional new cases that are coming. And again, we are going to say to you, where are these cases coming from in those areas? So last week, we shared with you a slide on the hotspots. So if you want to understand where is the big concern coming from, the interventions, the work that is being done by government, in conjunction with civil society, with various sectors, we are looking at the sub-districts in Gauteng. So a week ago, I shared with you where the active cases in the various sub-districts were. In various sub-districts in Johannesburg, the largest number of those active cases in Johannesburg last week was in the inner city. It was 263. That's last week, followed by the western part of Soweto, which would include Dobsonville, Doornkop, Roodepoort, because there's a bit of mining activity there. That's the area we link the outbreak of COVID-19 in that part of Soweto to the mining activity in that area. So our key concern would have been the inner city of Johannesburg, the western part of Soweto. But we also shared with you last week some of the areas in the suburban areas where we were concerned. That was Johannesburg. We shared with you last week what our concerns were in Ekurhuleni. It's always, particularly in Ekurhuleni, it's Ekurhuleni North 1 and Ekurhuleni North 2, and then you will see the changes this week. Where is that? In Tshwane, last week we shared with you where the concerns were in the CBD of Tshwane, and then Pretoria West, and that whole block towards Atteridgeville. Where are we this week? So this is where we are this week with regard to the changes that are taking place in these districts. The confirmed cases, you would see we have more confirmed cases in Johannesburg, more confirmed cases. Last week our concern was the CBD inner city and the CBD and the areas of Mayfair. You can see it is still our big concern this week. It's where the number of cases is increasing quite exponentially. The CBD of Johannesburg, the parts of the CBD that includes Mayfair. So we have the largest number of cases, active cases there, over 700 active cases are there. We also would still be very concerned about the areas I've referred to, Doornkop, Dobsonville, and the south, the western parts of Soweto that are kind of linked to the West Rand and Roodepoort in that area. I want to draw your attention to the fact that the area we were concerned about earlier on in Johannesburg, which was Ivory Park, the number of active cases in that area have essentially, there's a significant improvement as a result of the interventions we made. In that area, the same thing in Tshwane and in Ekurhuleni, we are still, the hotspots remains the same. The hotspots, remains the same in those areas. But the hotspots in the West Rand, you will see that although I showed you earlier on that we have significant recoveries in the West Rand, especially in Merafong, but we've got new cases coming up in the West Rand. New cases are coming up in Mogale City. And those cases, as I say, are linked to some mining activity in those areas. And the area which was a big concern for us, which was Merafong, it's still a big concern, but we have significant recoveries in that area. We have less active cases. 2 weeks ago, when we sounded the alarm bell, it was because we were just getting many cases at the same time. So interventions, the first storyline is that when we identify these hotspots and then we mobilize the resources to intervene in the hotspots, it does work. Principally, the storyline is it does work. Interventions do work. When you identify an area that has got new active cases, you arrest that by contact tracing, including those contacts having to be quarantined and additional measures in those areas. It does work. And that story that it does work is showing us and spurring us to do much more. But there are areas like the CBD of Johannesburg, when the area is very crowded, it can be extremely difficult. When it is also a transport node where a lot of people come together and it's a business hub, it can be extremely difficult. So we are extremely concerned at the moment by the substantial increase in the number of cases in the CBD of Johannesburg, in the CBD of Tshwane, that gets into the western part of the city of Tshwane, right up to Atteridgeville, and in Ekurhuleni. There is a new area in Ekurhuleni, the south, the Alberton area has got a significant increase in the number of cases. And the West Rand, we were concerned about Merafong, the Carltonville mining area, but we now have the Krugersdorp, Mogale City area in the last 7 days, also as an area of concern for us at just sub-district level. We're also sharing with you the exact numbers. In 7 days, the actual increases per sub-district. You will see the inner city of Johannesburg now has the largest number of cases in Johannesburg, but 438 new cases in 7 days. And it will be followed by the area I was referring to of the western part of Soweto, Dobsonville, Doornkop, Snake Park, Roodepoort, and that area also included a bit of also illegal mining activity. We're extremely worried also about that. And then after that, you have the other areas in Johannesburg which are concerned. In Tshwane, we've got 2 areas that in the last 7 days have reported more than 100 cases. The first area would be the Atteridgeville, Pretoria West, Lodium, Lotus Gardens belt. And the second area would be the Eldorraine, Waterkloof, that's the Centurion part of Tshwane. So there are 2 areas of concern for us in Tshwane. As I said, there are 2 areas of concern for us in Johannesburg in the last 7 days. And our interventions are going to be directed there. In Ekurhuleni, we have always been concerned about Ekurhuleni North. That includes Tembisa, portions of Ivory Park, portions Winnie Mandela. But there's the Davidton area, Davidton-Etwatwa area in the last 7 days has become an important area of concern for us, as well as the Boksburg area, which include portions of Bedford View, Germiston. The numbers, you will see them there, essentially. And the West Rand, you can now see that actually Mogale City in the last 7 days has surpassed Merafong in the number of new cases. So we've had 95 new cases in Mogale City. That's the point we were explaining to you, that we have been able, the interventions to ensure that to fight the fires in Merafong, that intervention has worked. We have arrested the growth in the number of cases in Merafong, but we've got a new area that's coming up that has got 95 more. So in the last 7 days, we have had more cases in Mogale City than in Merafong. Again, we do the same. So our interventions is to ensure that we trace all the contacts. We have a sense of what is the source of the outbreak. Where people need to be quarantined, they have to be quarantined in that way, and others essentially receive our attention and help in that regard. Immunization, the immunization program is continuing. You see the difference is almost like 3,000, and it's essentially because we do not have a sufficient stock, and the priority has been determined that it is not, the flu immunization is not for everybody. So the difference between last week and now is an additional 3,000 more people have been immunized. Priorities, the staff, particularly the healthcare workers, the elderly people, children, pregnant women, chronic patients, and those patients who have HIV and AIDS. These are always our priorities. As I say, the increase is very, very small because that's where the concentration is around flu immunization, the flu vaccine. Screening is still important. You can see we have now surpassed 7 million people. We have screened 7.4 million people in Gauteng. We are continuing to do screening. We have never abandoned screening. We've always combined screening with testing. The full number of the breakdown you will have there of where the 7.4 million people are coming from. But the largest screening program was in Tshwane. In Tshwane, we were able to screen more people than anywhere in our province. We have screened 2.4 million people in Tshwane, whereas in Ekurhuleni and Johannesburg, we have screened 1.7 million in each of those. And in the districts, 500,000 people in the West Rand and 500,000 people in Sidibeng. That's screening. With regard to testing, the latest figures from the National Health Laboratory Services still would show that out of the 1 million people who have been tested in South Africa, 33% of those tests were done in Gauteng. That is 338,211 people were tested in Gauteng. Contact tracing, we're still doing our best with regard to contact tracing. Every part of our province, all our regions, we do 100% contact tracing. Particularly here, we're talking about the new cases. As soon as those numbers arrive and as soon as we're able to get the full breakdown, we do that the following day once they are announced. We ensure that we do the tracing of all the contacts, all those who have had interaction with those who have tested positive. That's something we would still think is very, very important. If you look at the number of beds, that hasn't changed, current available beds in the public and private sector. Next week when we brief you, we will give you additional new beds that will be coming on stream, particularly those that we have been adding as the provincial government. but the total number of beds that are available in both the public and the private sector, that number is as is, but you would also understand that as more people are admitted in hospitals, the number of beds available will be fewer. The only way to deal with it is to add more beds, either through field hospitals or additional beds that we are adding through ABT, alternative building technology. And you would know that in this province we are going to add 1,500 beds. Firstly, 1,400 out of alternative building technology. We are adding those beds in our existing hospitals, but we are also upgrading a hospital that is in the West Rand, a hospital that was owned by the mine in the West Rand. We are upgrading it to, which will bring us 1,500 additional beds. All these additional beds will be available by the end of July. And July is a critical month for us. All modeling that is done at a national level and at a provincial level indicates that July is a critical month for us. It is a critical month. We should be able to have additional beds as we move to August and September, which is anticipated as the peak. So next week we will give you additional information around the field hospitals. In addition to all this, what is our field hospital plan in this province and when are those beds coming on stream? We will share with you that information next week. Importantly, what is happening with our hospitals at the moment with regard to COVID-19 patients, you would see that there is an increase in the number of admissions in our hospitals. So hospital admissions or hospitalizations have increased. We currently have 493 people who are admitted in hospital. 357 are in the private hospitals and 136 are in the public hospitals. We give you a full breakdown. Those who are on ventilators are 22, and those who are just on oxygen, we give you a full breakdown of that in the ICU wards as well as in the general wards. So in total, we have 493 people who are admitted in hospitals. Ever since the patient zero, we have discharged 476 people from our hospitals. And these are people who have fully recovered. If you add that plus the 57 who have passed on, that accounts for the full total of people who have come into our hospitals who were infected with COVID-19. And since patient zero up to today, the cumulative number of people who have come into our hospitals, both public and private, is 1,033. That's the full number. And then 476 have been discharged because they have fully recovered. So the critical question now is that our focus, as we deal with all other interventions in the hotspots, our focus is also on the 493 patients. Whether they are in the public sector or in the private sector, they are our daily story. We worry about them. We make sure that the MEC and his team are able to check the progress of those and who are the ones that are recovering and who are the ones that are facing difficulties. We also want to take this opportunity to report with regard to government as the institution. The Gauteng provincial government as an institution has 172,113 employees. So we have 172,113 employees. These are people who work for the Gauteng provincial government. Out of that, 335 have tested positive since March. So this is 335 is a cumulative number of those employees of the provincial government who have tested positive. This number includes the health workers. It also includes the educators in our care, and in total, the cumulative number so far is 335. In there, it includes those who have recovered. There's a substantial number of those who have recovered as we speak. It is important that we also report as a workplace about this because COVID-19 is a notifiable disease. Like all other patients, affected staff members and their families are also receiving support, they are receiving care, they are receiving various forms of support, and those who were, we needed to ensure we put in place quarantine because they can't self-quarantine or they can't self-isolate. We have also been able to do so. But we are, as an employer, we are obliged to enforce WHO protocols also in our workplaces. I also want to say that once a staff member tests positive, we also go and ensure that we trace their contacts. We do exactly what we do with everybody in society, to trace their contacts, to ensure that in the period, those contacts themselves take measures because they don't know their status. They take measures to isolate themselves. That includes people in government. That once anybody tests positive that we have interacted with, we take measures ourselves to make sure that we also test, but we also ensure in the meantime we self-isolate and minimize the interaction with the other people until we also get the results. It's very, very important because that's the way we will prevent spreading the disease and the virus to the colleagues with whom we work. So all these protocols do apply. We also decontaminate buildings. Once there is a member of staff who tests positive in any office, in any building of government, in any establishment, we also immediately decontaminate the building and ensure that that building is the first thing we do. We will close for a few days and reopen after the building has been decontaminated. Again, this is what we say the employers must do, so we do the same. As part of continuous medical surveillance protocol, we also ensure that every day when employees of government arrive in buildings where they are, they undergo screening. And some of them, it is out of that screening exercise that some of them get referred to testing. So we do, as an employer, also ensure that we do test. And I must also say that even us who are in positions of responsibility assigned by the citizens of our country, even with ourselves, we do take care and take measures to ensure that from time to time we subject ourselves to these processes of screening, including testing, especially once you have come into contact with somebody that you work with, and only return to normality. By normality, I mean return to active service when we are sure that you are in the clear. We think that's very, very important, that people in leadership must also do that. This is PPE. This is an update. We always give you this update, how much PPE stock we have in the balance, 16 million, and how much have we ordered. We still ordered another 14 million PPE. This is very important in the battle against COVID-19, especially as the pandemic gains momentum. I said at the beginning that these numbers show that the pandemic is gaining momentum in our province. With regard to food relief, We are now at 1.1 million with regard to the number of people who have been assisted with food relief. Last week, Friday, I announced that we have just hit 1 million. We have surpassed that number now with another 128,000 people who have been able to receive food support in our province. That includes the number of those who are homeless. You will see that the number of homeless people in our facilities is going down, and this we always share with you. It used to be 3,100. It is going down now. It's at 2,868 because there are those who leave these facilities. But we've also reported to you last week that we reunited some of the homeless people with their families. With regard to schools, I want to say to you that in the last 7 days, one of them, the most critical areas of focus of the provincial government has been on the schools. So overall, in Gauteng province, we can say to you, so you know, our mantra is safety first, safety particularly for our children in schools, for our teachers and the workers who are in the schools. We want to share with you one bright spark is that with the return of grade 7 and grade 12 learners, 85% of both the learners and the teachers were able to report to our schools as of the week. This number might increase, but this being the first week, it's very, very important for us. So we have been able to get back into our schools 85% of the teachers and the learners we wanted back. You need to understand that we don't only have the grade 7 and grade 12 teachers, we also have teachers of other grades who are preparing for the next phase because we are opening our schools in different phases. So we have more than the grade 7 and the grade 12 teachers because the others are preparing for the reopening of the next grades. And I'm going to come back to that issue about how we are doing it. We are doing it as on the risk-adjusted basis, and when we are also drawing important lessons about how soon should we be going to bringing in other classes on stream. We have to watch what's happening with the grade 7s and the grade 12s, especially with the progression of the pandemic. How many teachers are infected because and we want to share with you some of the important observations for this first week. So firstly, you would know that last week we reported that there were 25 schools that had infrastructure challenges. And those schools, we said those schools would not reopen. By the 7th of June, this number had been reduced to 11 schools that could not open. We also had by the 11th, essentially by yesterday, we also had 5 schools that had challenges that are being addressed by contractors. Those schools are receiving attention. So we've been reducing the number of schools that were not ready, and we are satisfied that in the coming week we will have many more schools that will be able to open. And as of yesterday, 6 more schools have opened as the infrastructure in those schools had been resolved. And another 6 schools will continue to receive the attention of our contractors. We must raise a concern about 7 more schools have been vandalized, and we are facing a battle here. So we are doing everything to get our schools ready, but we also getting the criminal element in our communities that's targeting the schools. I can tell you the police have arrested more than 400 criminals, and they are suspects. Yes, they have been arrested, people associated with the vandalization of our schools. More than 400 of them have been arrested in Gauteng so far. But we continue to have the problem related to the vandalization of schools in our province. And in total, we have 13 schools that are facing this challenge, but we are doing everything to prepare the schools to reopen by Monday again, next week Monday, the 15th. I know that Monday may be a holiday as a result of June 16, but we are getting those schools ready to reopen on Monday. We have been able to attend to the issues of water, including water tanks in some of the areas, but we know there are communities where when we attend to water tanks for the schools, if there is no water in that area, there's been a disruption. We had an incident in Orange Farm as a result of this. We are also attending to issues of sanitation in our schools. We also had a few problems of electricity in some of our schools, but all those issues are receiving full attention from our Department of Education. With the availability of PPEs, all schools have received their PPEs. We have been distributing PPEs, including to learners. It has been a very interesting week to observe how learners' behavior has been changing in this whole week, including how learners are learning new ways of interacting with both their friends and their teachers. That includes some of the problems of the masks that learners have been given. We are replacing those masks. School nutrition has gone extremely well. There's no problem that we have experienced with feeding the grade 7s and grade 12s that are back at school now. Learner transport, we also have had a lot of interventions done by our Department of Transport to assist. The deployment of the youth brigade has helped, but there's some areas of risk that I'm going to come back to, because this has been a week of learning basically for us, and it is giving us indications of what it will look like if we go to July 6th, which is bringing back all the other big numbers, almost 1.3 million learners. That's one critical issue that we are thinking about now and drawing the necessary lessons. The orientation of the brigades has taken place, and the training of teachers and learners from the first day for them to adapt to new ways of working and new ways of doing things. And the deployment of the brigades have also taken place in the different schools in our province. Wherever there were problems, we were able to crack those problems. We are sharing with you now the number of COVID cases. As we go on, we pick up a school where there is a COVID case. So far it has largely been with the staff, either a teacher. And the good thing is that the screening helps. When the teachers come back, they come every day, they get screened as we do with the learners. Through that screening process, there are teachers who were referred for testing, and you would see how many schools we have had COVID cases in each of those. As I say, so far, it has largely been the adults in our schools. The full number of the schools is here. The information, we are disclosing that information to share with members of the public from the 9th, the 10th, and the 11th with regard to how many people in our province, especially in our schools, have tested positive. What do you do with a school where you have a positive case? We close the school and have to decontaminate the school again. But we want to make sure that it doesn't, there mustn't be reasons other than science where a school closes for too long. Once there's a COVID case at a school and the school has been decontaminated, we would like to ensure that the school is reopened along all the measures that have been put in place. There are areas of risk that we are dealing with, yes. We are having fewer learners at the moment. It's grade 7 and grade 12. Even with them, the area of risk, we are worrying about the period ahead in July. Overcrowding will become an issue. At the moment, we still have fewer learners. We are able to do social distancing in the classrooms. These learners, not at all times. It's very difficult. You should understand these are children. For them to be wearing masks at all times when they are at school in 1 week, it will take time for them to get used to that. So there are occasions our teams have been observing. There are occasions where the learners wouldn't necessarily been wearing masks, but it's something, it's a behavioral change that will take time, that must be cultivated, including how our children have to be interacting during break. As we say, so far the numbers are still fewer. We are more worried about when the numbers will be more. If we bring 1.3 million more learners into our schools, this areas of risk will be accentuated. They'll become a big headache for us. We've got some of our schools where the fencing is a problem that's being attended to. The contractors are fixing that so that we have proper controls on who goes into each of our schools. Yes, there are areas where the local business forums have disrupted, have caused problems, caused disruptions in the preparation work that is being done, but we are dealing with this issue. We always do so when it is local business people who want government support. We always say to them, you can get government support by engaging with government, but criminal elements must not seize the opportunity. Go and burn down a school, hoping that they will get an opportunity to fix the school. We don't allow that, and that's where the police arrest these criminal elements. We also have had some challenges with regard to the break-ins in our schools, where the criminals basically target PPE, they target technology, they target the storerooms where we store food in our storerooms. They do that, and there's 1 or 2 cases where we had a problem with our scanners. For checking temperature, that's being attended to. I want to conclude today's briefing by saying last week we said to you at the briefing that our province has entered a new period in the battle against COVID-19 pandemic. We said so last week. For a long time we've been emphasizing that the period ahead will be difficult. For a long time we've been saying that even as we were doing well, we were doing our best, the rate of infections were lower, but we kept communicating that the period ahead is going to be difficult. And I want to say that we are right in the flu season now. We're still going to go through July. The flu season would be a great concern ahead of us. The peak is still far ahead of us, and we are beginning to see that the number of new cases in our province is increasing exponentially. And in the past 7 days, we showed you that data. In the past 7 days, our number of cases have doubled in terms of new cases. The hospital admissions have also increased. So far, we can still cope with the number of people who are admitted in our hospitals. The hospitalization rate versus bed availability is still not an issue at the moment, but we are continuing to prepare for what will be the situation in July based on our modeling, and what will be the situation in August and in September based on our modeling. I've also said that we have lost 20 more people who have succumbed to COVID-19 in the last 7 days, and have made this point clear that the pandemic is gaining momentum. Everybody needs to get the message clear, loud and clear, that we need to do everything in our power. We need to do those things that we can do ourselves. Let's wear masks when we go out, leave our homes, to go anywhere outside our homes. Let's wash our hands. Let's sanitize. And the issue of physical distancing, it's something that we should do even in difficult circumstances where people may find it very difficult, where people live together in large numbers, intergenerational living. in households where there are more people, but there are things we can do. It is within our power. We can slow down the infection rate. We can overcome as a people. So we must face the reality head on, and that reality is that the pandemic is gaining momentum in our province. We must mobilize all our energies and our resources to save more lives, to ensure that we can do everything we can say in history we were able to do at this given moment. So we use this opportunity to call on every sector of the population in Gauteng province. Don't dismiss COVID-19 just as something that's not there. COVID-19 is here. We are now seeing it every part of our province. We are going from area to area, dousing the fires. We've seen the hotspots. The numbers of hotspots are increasing. The numbers in those hotspots are also increasing. In some of the hotspots, we are containing the growth of infections in some of the hotspots, but we have to do this together. We must be fighting this, all of us. It's not government that's going to win this battle. It's the people united in action. As a province, we want to indicate to you that this coming week, we have had an interaction already this past week with the Minister of Health, and this coming week we are seeking a meeting with the Minister of Health to say that we want to say to the Minister of Health, we need reinforcement in a number of areas in the fight against COVID. We are not a province that will resist help. We are not a province that when national government says we want to assist you, that will try to push national government out. We don't want to wait until we have hit a critical period. We want in the coming week to meet with the Minister of Health and say we need reinforcement in a number of areas in our province. Particularly in these hotspots, we need reinforcement with the intervention teams to help us contain this. And as I say, that's the nature of Gauteng. We don't wait until it is too late. We want to be proactive and say we need reinforcement, we need support, we need continued support. We want to thank the President and the Minister. They have been to our province. The Minister has been here a few times. The President has been here to say that in the coming week we are going to be asking for reinforcement in all areas because we can see that the pandemic is gaining momentum and we don't wait until the national government has to decide to bring reinforcement here. We invite reinforcement in Gauteng province to reinforce our efforts, to understand our strategy. One of the things we are also re-looking is the testing strategy. We have done lots of tests. We have done tests in communities. We are now reviewing community testing as a province. We are reviewing that to direct our testing, as we said, specifically to the hotspots, but we have also been doing testing in institutions, to do testing in our hospitals, in our clinics, to also ensure that the tests, the available tests that are there are directed to where they are needed most in these hotspots, to ensure also that we protect our health workers, but our civil servants. We have many civil servants that are doing tremendous good work. They are on the cold face of this battle. Others are police officials. Others are healthcare workers. Some of these are educators. We want our resources, testing resources, to be able to go to the hotspots, but to also go to those sections of the population, including the most vulnerable people in the population, the elderly people, people who are having other ailments. So that's one of the things we discussed with the Minister of Health last week when we met with him. And in the coming week, we will concretize this approach, that a new approach in testing that we are going to implement. We want again to call on the people of our province not to go about as if COVID-19 is not here. COVID-19 is not a rumor. It is real. It is around. And it is almost there in every district in Gauteng province. In every district. In the data that we have shown you, there are only 2 sub-districts that have less than 7 cases. Only 2 sub-districts in Gauteng. Most of the sub-districts, their cases have been increasing on a daily basis. I've also said that we are concerned about the surge in the number of trauma cases in our hospitals. The trauma units in our hospitals were empty. We were reserving those trauma units as additional beds to help treat COVID patients. But since the start of level 3, we now have a lot more admissions of people who essentially get admitted into hospitals out of alcohol-related, either an accident or violent activity or fight with somebody. We are deeply concerned about this matter, and we will be taking this matter up with the national government because those trauma beds, we need them for COVID-19. We also need them for other cases that because our hospitals are open for all other cases. We will need to be paying attention to the burden of disease. It's not only COVID-19 that we are dealing with. We need those beds for other patients as well. As we enter the winter season, we are faced with a challenging period ahead, but we are equal to the task. We would like to share this information with the people of our province so that all of them, wherever they are.
All right, you were watching David Makura, the Gauteng Premier, giving us an update.